Assalamu alaikum. I am Dr. Mahmud Tushar, lecturer, Department of Pharmacology. Today our topic of discussion is aminoglycosides and tetracyclines. First of all, aminoglycosides. Aminoglycosides have hexose ring, either streptidine or 2-deoxystreptamine, in which various amino sugars are attached by glycosidic linkage. These are the antibiotics or protein synthesis inhibitors. They are active against aerobic gram-negative microorganisms. Now, different classifications of aminoglycosides. According to the source, aminoglycoside can be classified into natural and synthetic. And natural are derived from the streptomyces are streptomycin, neomycin, kanamycin, tobramycin, and derived from the micromonosporas are gentamicin, cisomycin, netlimycin, and synthetic aminoglycosides are amikacin, netylmycin, and according to the route of administration, drugs can be classified as systemic and topical and oral. Systemic routes are gentamicin, amikacin, streptomycin, tobramycin, and topicals are neomycin, framycetin, and oral are neomycin and paromomycin. Now, the common properties of aminoglycosides. Here, the aminoglycosides have hexose rings which is attached to the various amino sugars by glycosidic linkage, and they are water soluble, must be given in parenteral route, either IV or IM route. And they are more active in alkaline pH, irreversibly protein synthesis inhibits the protein synthesis. It can cross the blood-brain barrier, placental barrier, but cannot cross the blood-brain barrier, except inflamed meninges. These drugs are excreted by renal routes, and single dose is effective because they have they kill the microorganisms, and they have significant concentration dependent killing and has post antibiotic effect. Now, once daily dosing of aminoglycosides, aminoglycosides have concentration dependent killing and significant post antibiotics effects. That's why numerous studies demonstrate that a single dose is just effective than multiple doses. It can cause this single dose is cost effective and also lends outpatient therapy. Exceptions of daily on dose, pregnancy, in case of neonatal infection, severe infection, bacterial endocarditis. In these cases, these drugs are administered 8 hourly. Now, mechanism action of aminoglycosides. These are the irreversible inhibitors of protein synthesis. It causes, it is passive diffusion of the drug occurs via the porin channels. Drug is then actively transported across the cell membrane into the cytoplasm by an oxygen dependent process, binding to the 30S ribosomal subunit, and then protein synthesis is inhibited by prevention of binding of protein, misreading of mRNA, breakup of polysome into non-functional monosomes. Now, the indications. Mostly used against gram-negative enteric bacteria. Parenteral route, it is used, gentamicin is used in severe infections such as sepsis, pneumonia caused by gram-negative microorganisms, endocarditis, staphylococcal endocarditis, meningitis caused by the gram-negative bacilli, tuberculosis, and plague, tularemia, and brucellosis. Now, the indications of topical routes are topical gentamicin or neomycin is used in infected burn, severe wound, or skin infections. And intrathecal administration of aminoglycoside is used in meningitis caused by the gram-negative bacteria. The indications of neomycins. The topical route of topically the neomycin is used in case of burn, wound, or infection, and oral route the neomycin is used before the bowel surgery or any operation, GIT operations, and it is also used in hepatic failure to suppress the coliform flora to prevent the ammonia intoxication. Now, adverse effect of aminoglycosides are ototoxicity. It causes ototoxicity, either vestibular dysfunction or cochlear dysfunction, nephrotoxicity, neuromuscular blockades, and hypersensitivity. Now, drug interactions. Aminoglycosides plus loop diuretics. Aminoglycosides, they are mainly ototoxic drugs. They causes the irreversible ototoxicity, and in case of loop diuretics such as furosemide, this also causes ototoxicity, and both the drugs can do the pharmacological potentiation and causes the ototoxicity. And aminoglycosides and cephalosporins, both drugs are nephrotoxic drugs leading to pharmacological potentiation. Aminoglycosides and neuromuscular blockers such as simultaneous administration will enhance the paralysis. Aminoglycosides and penicillin, they causes increase the antibacterial spectrum activity, because the penicillin inhibits the cell wall synthesis, which enhances the uptake of the aminoglycosides. It reduces the duration of therapy. So thank you. So this was all about aminoglycosides.